What is Prescription Advantage? I'm sure a lot of you have heard of it before, and maybe some of you are already members. But Prescription Advantage, it is a state-sponsored prescription drug program, and it's for older adults and also younger people with disabilities. And the program is administered by the Massachusetts Executive Office of Elder Affairs. So this is a state-sponsored program. And one thing I want to mention is if you have Medicare, and many of you may have a Medicare prescription drug plan, this does not replace what you currently have for insurance. Okay, this really acts more of a supplement. So we'll be getting into a lot of those details. And it is a program that is based on income. So you might want to have a pen and paper handy. It gets so confusing sometimes when you're talking about all of these numbers, but we'll go through them all. Okay. Now, as far as who is eligible for Prescription Advantage, because it is a state-sponsored program, naturally, our members must be Massachusetts residents. And we have benefits for people who are age 65 and over, who are eligible for Medicare, but also people who are 65 and over and not eligible for Medicare. And then we have members who are under age 65 who have a disability. And I'm going to be talking about each one of these because the benefits vary depending on which group somebody is in. But also who is not eligible for benefits, and this would be anybody who has Mass Health, Common Health, or a Mass Health buy-in program. And Mass Health buy-in programs are also known as Medicare savings programs. Now, the reason why people with any of these programs would not be eligible is because with those programs, Mass Health, Common Health, or a buy-in program, prescription drug coverage is already being subsidized with these programs, and co-pays are already being lowered. So quite frankly, people who have these programs really don't need Prescription Advantage. So who we're looking for is those people who don't qualify for these programs, but still could benefit from assistance with their prescription drug coverage. So I'm just going to talk briefly about members under age 65. Okay. If somebody is under age 65, we do have very tight eligibility guidelines. First of all, they cannot work more than 40 hours per month. Income cannot exceed, if you notice on the screen, for a single person, income cannot exceed $24,214. For a married couple, income cannot exceed $32,750. People must also be able to provide us with proof of disability, so we would be looking for documentation. But if somebody does qualify, if they meet the income limits, they're able to provide us proof of their disability, there is no premium or enrollment fee for this coverage. And so it's free. This is free insurance. And also one nice thing is that we put a cap on how much somebody would be spending out of pocket each year. Now, in terms of how the benefits would work, if somebody is under age 65 with a disability and they do not have Medicare, we would be the primary coverage. If they're under 65 and they do have Medicare, then we would become a secondary payer to Medicare. So what happens is when somebody is under age 65, and it's determined through Social Security that they are disabled. Okay. Once they're disabled for 24 months, then they become eligible for Medicare. So you could have somebody who's 50 years old, has been disabled for 2 years, now they're 52, but now they're eligible for Medicare. So they didn't have to wait until they're 65. And as I mentioned, people, when they do not have Medicare, we would be the primary payer, which means we're going to issue our members an ID card. They use that when they go to the pharmacy, or they use it if they're using mail order. And the pharmacy is going to bill Prescription Advantage directly. And we have 3 levels of copays. A level 1 is for generic drugs. A level 2 is for brand name. And notice these are based on a 30-day supply. And a level 3 is for what we often call a non-preferred drug. And that's usually a brand name drug that now has a generic equivalent. So if you think of something like Lipitor, and Lipitor is the brand name, but there are a lot of generic drugs that are equivalent to Lipitor. If somebody still continues to take Lipitor, they will pay that $40 copay as opposed to the $18. Once the individual becomes eligible for Medicare, and we're going to be a secondary payer, okay, now there's just 2 levels of copays. It's the drug we consider, it's either a generic drug or it's a brand name drug. And copays would never be more than $7 or $18. Okay. We're going to be talking in more detail about Prescription Advantage being a secondary payer, because again, for those of you who may have a Medicare prescription drug plan, okay, this is where Prescription Advantage is, will act as a secondary. We do have benefits for individuals who are over age 65 and not eligible for Medicare. And I often get asked, or people will often say to me, I thought once you turn 65, everybody is eligible for Medicare. It's just something that comes automatically. But that's not the case. What determines eligibility for Medicare is how many years you contributed to Social Security. So if somebody, you've often probably had heard the term like 40 quarters, you needed 40 quarters to be eligible for Social Security or for Medicare. Well, what 40 quarters really equates to is 10 years. But we do have many members who moved to this country later in life. They moved to Massachusetts, and they may never have contributed to Medicare, or maybe they're working now, but they just haven't contributed long enough. So if they're over 65 and not eligible yet, then we will be, again, a primary prescription drug coverage. And there are no income or asset limits. Again, no monthly premium. It's just copays and deductibles are going to be based on income. So it's really like a sliding scale. For those who have more limited income, their copays will be lower. But if they are working and if income is higher, then their copays may be a little higher. And my last group, and again, this is really the bulk of our membership. And these are our members who are age 65 and over and eligible for Medicare. So this now means that we are a secondary payer. So in order for somebody to have benefits, they need to have a primary payer in place. And that primary payer can be either a Medicare Part D plan, or it could be a Medicare Advantage plan. I know a lot of people have Tufts or Fallon or Harvard Pilgrim. Those are those HMO type of plans, but they include the prescription drug coverage, and will be a secondary payer to that. The other thing that we will also be a secondary payer to somebody who may have what we refer to as creditable coverage. And creditable coverage is prescription drug coverage that somebody might have that's not a Part D plan, but it may be a benefit that they received from a former employer or maybe through a union, but that is the individual's prescription drug coverage. Okay, we can also be a secondary payer to that. And now you notice we have income limits again. For a single person, income cannot exceed $64,400, or for a married couple, income cannot exceed $87,100. Okay. These are very generous income guidelines, and people are often very surprised when they see this, because when they think a state-sponsored program, you must have to have very limited income, but no, that's not the case. And we'll go over the benefits because benefits will vary depending on what a person's income is. But one thing I do want to mention is that with Prescription Advantage, we determine eligibility based on income. One thing that we don't look at is assets. Again, surprising, because most programs, whether they're other federal or state programs, they tend to look at both. What is your income and what are your assets? Prescription Advantage, we look at gross annual income only. One of the things we do, and with our application form, we want to make sure people are getting benefits that they qualify for. And what happens often is that there are so many programs that people could be available for, but they don't even know that they exist. So part of our application process is we're going to take a look at a person's income, and we're going to look to see, does it appear that somebody may qualify for these other programs? And if they do, we will require that they apply for them. So what happens is during the application process, if it appears that somebody may qualify, our customer service representatives will call you. They'll just get right on the phone and they'll tell you, you know, I'm looking your application over and it looks like you may qualify for extra help. And if that's the case, they'll even offer to assist you with doing the extra help application. Or they might see that you may qualify for one of those Medicare savings programs. So they will direct you to Mass Health to get an application for one of those. So these are all intended, you know, they're to save you money, and we want to make sure that you are getting, you know, you're getting the benefits that you're entitled to. So Prescription Advantage, though, as I mentioned, you know, I pointed out those income ranges, and I mentioned that for a single person, it goes as high as $64,400. For a married couple, it goes up to $87,100. So how we determine where you fit, you notice on the left-hand side, we have membership categories. They start with S0 and they go down through S5. Okay, these are just our little names for the categories. Then we look at your income, and then we determine based on your income, we have it grouped in income ranges, and we look and say, okay, well, based on your income, you would be in the S2 category, or maybe you'd be in the S4 category. And depending on what category you're in, this is also going to determine when your benefits will begin. So you notice we have our S0 and S1 categories. Okay, people at those income levels, benefits begin immediately. Then we get to the S2, and if you notice with S2, S3, and S4, they all say the same thing. Benefits will begin when members' total retail drug cost reaches $4,130. Okay. So prior to that happening, Prescription Advantage isn't providing any assistance, but we're waiting. We're keeping track of what your drug costs are. And so we will know when you reach that $4,130. So that number, $4,130, it's not a number that we just pulled out of the air. It's a very significant number. That is the point when somebody reaches the coverage gap. So if you have a Medicare Part D plan, or if you have a Medicare Advantage plan, okay, it's when your drug costs reach that amount, okay, that means you reached the gap. Or you may have heard it referred to as the donut hole. Okay, I think that's the term we tend to know most often. So let's just talk about that, because I think what's important is the fact that it's, because I keep saying it's the total retail cost. So it's not just what you're spending out of your pocket, but it's also what your Part D plan is also paying. So in my example here, you notice, okay, I just took, let's say you have a prescription for an inhaler. And okay, inhalers are expensive. My example shows that the total retail cost of this inhaler is $400, but I've seen them go even a lot higher than that. But when you're having that inhaler filled, okay, you might be paying a $50 copay. But if you're paying $50, then that means your Part D plan is paying the other $350. So when you add the two together, that makes the total retail cost $400. So if that means that you would reach the coverage gap when the total retail costs of your prescriptions reaches that $4,130, well, that could very well happen in October, or depending on what other prescriptions you might be taking, because every month your plan is keeping track of every prescription, every retail cost, and they're adding it all up. So then what happens when you reach the gap? Okay, this is where you would now be responsible for 25% of the total retail cost. So your copay just went up quite a bit. In fact, in this example, it doubled. So if you have a $400 prescription and you're responsible for 25%, well, that's $100. Your plan will pay $300, but now you're responsible for $100. So this is where Prescription Advantage can help. When you're a Prescription Advantage member, we issue you an ID card. And I think what's the most important thing is that your pharmacy knows that you have this coverage. Because what's going to happen is your pharmacy is going to bill Prescription Advantage automatically. Okay? You don't have to fill out any claim forms. Okay? What will happen is your pharmacy is going to bill your primary insurance first, and then any balance is going to be billed to Prescription Advantage. So if it's the beginning of the year and you're in a category where benefits they don't begin until your drug costs reach that $4,130, well, because the pharmacy is billing us every claim, we know, we will know exactly at what point you reach that amount. So we know when to jump in and help. So going back to my $400 inhaler, what's going to happen is you reach the coverage gap, your copay would go up to $100. Your pharmacy is going to bill that $100 directly to Prescription Advantage. And if you're in the S2 membership category, okay, you will be charged $18. Can you imagine to have that kind of savings right off the bat? If you're in the S3 or S4 category, you would be charged $30. So right there, It's a big savings. And from that point to the end of the year, you would never pay any more than these copays. Now, I do want to backtrack a little bit to talk about the S5 category, because the S5 category is different. And this particular category, it's the only time that members do pay for Prescription Advantage. Okay, we do charge a $200 annual enrollment fee. And the way this works is once our member spends $3,830 out of their pocket, okay, so that's in copays. If you were in this category and if you spent that $3,800 out of pocket, as soon as you spent that, and again, that's within the same calendar year, once you spend that, that's when we would say, put your wallet away. From this point to the end of the year, you don't have any more copays. So that is, again, that's the most that you would have to spend. And I know it's a lot of money, but you know, we have members in this category that we started paying their claims in January. So from their very first prescriptions in January, because they were so expensive, you know, you just need a $10,000 prescription drug, and you could spend that could be your copay very, very easily. So for a lot of people, this does work. Just a couple of other added benefits with Prescription Advantage. First of all, you can enroll at any time. Okay. We're not like Medicare that has a little window of time every year when they have their open enrollment period. Prescription Advantage, you can join anytime. And what's nice about that is oftentimes people don't realize that they are about to reach the donut hole. Or maybe they just found themselves in the donut hole and they really, okay, join Prescription Advantage. You know, we can't help you for, you know, with what you've already spent, but from the point that you become effective for benefits, we can help you for the rest of the year going forward. And also, another benefit is that being a Prescription Advantage member gives you what we call a Medicare special enrollment period. And this is really a very valuable thing to have. Shine counselors will also refer to this as your get out of jail free card. Because what happens, you know, here we are, you know, we're not even halfway through the year, and you're in a Medicare Part D plan, it's working great, and then all of a sudden your doctor prescribes you a new medication that you find out is not covered by your plan. And you know, what if it's an expensive medication and now you're on the hook for it because it's not on the plan's formulary? Okay, this is where, you know, you can change your plan. You don't have to stay in a plan that's not working for you for the remainder of the year. And this is something that Shine, if you're not familiar with your Shine counselor, you should be, okay? Because at every Council on Aging, Senior Center, there is a Shine counselor. They are doing their visits remotely right now, but this is who you'd want to talk to and say, you know, I had this great plan, but now I have a medication that's not covered. What can I do? And your Shine counsel will say, well, do you have Prescription Advantage? And if you don't, he or she will help you get onto Prescription Advantage so that you'll have that opportunity to change your plan. So how to apply for Prescription Advantage? Okay, we have paper application, We have them on our website. Also, you could call Prescription Advantage and they would be happy to put one in the mail to you. We also have an online application. So again, on our website, if you're comfortable with the computer and you say, this looks easy, I can just enter this myself, then go right ahead. You can enter the application, or you can do it by telephone. And if you were to call Prescription Advantage to request a paper application, they will offer to do it over the phone with you. You know, sometimes that's often my preferred way of doing it, because now you have an opportunity to have a one-on-one conversation with a Prescription Advantage representative. So while they're entering your application, you can be asking questions about how all of this works. So it's a nice way to do it. And I'll tell you that our Prescription Advantage staff, if any of you have ever had the opportunity to talk with any of them, I think you'll all agree, they are the most patient, kind people that, you know, they're not going to rush you. You know, if you have questions, they're there to answer them. So our phone number, it's an 800 number. It's 1-800-243-4636. Prescription Advantage is available Monday through Friday from 9 to 5. And of course, our website, which is www.prescriptionadvantagema.org. And just in closing, a couple of helpful resources. I did mention Shine. Again, you know, Shine is a terrific resource. And anytime, if you have any questions about your Medicare, if you have your prescription drug coverage, the people to answer your questions. And this is a free service. So you certainly want to be able to reach out. And if you notice, they have the same phone number. Okay, it's the 1-800-243-4636. And another program that's available is through the Massachusetts College of Pharmacy. They call it the MCPHS University Pharmacy Outreach Program. Again, a free service where you can call their toll-free number, which is 1-866-633-1617. And they can do a number of things, because you're talking with a pharmacist or a pharmacy student. You know, if you have any questions about your medications, or if you're concerned about the cost of your medications, you might be taking a prescription that has a very high copay, and they might be able to tell you of something that is equivalent, that's a lot less expensive. And that's information that you can bring back to your doctor and just say, you know, I heard about this other drug, and is this something that I would be able to take? They also know of other programs. So, you know, if you're just having difficulty paying for your prescriptions, they know of other pharmacy assistance programs. They would talk with you about Prescription Advantage, but then they know of others that they would talk to you about as well. So great resource to make sure that you're taking your medications correctly, or just any questions about the cost of medications. Okay. And I have a feeling this might be my last slide. Right. Okay, so I'm just going to stop sharing my screen so that I can see all of you. And if any of you have any questions for me, don't be shy. This is your chance.
Other states, oh, wait a minute. Do other states offer these plans, or is it any through the federal government?
You know, as far as a state pharmacy assistance program, which is what Prescription Advantage is. There are other states that do have them. Not all states. There used to be a lot more than there are now. There's probably, I don't even know if there's 20 states now. And because they're all funded by the state, it really depends on each state's individual budget. So I think that our benefits.
Would they have different names or
Yes,
similar?
absolutely. They call them all something different.
Thank you.
Did you have a state in mind?
Illinois.
I have no idea about Illinois. I'm sorry.
Okay.
If you said New Hampshire, I could easily say, nope, they don't have one.
Oh, all right. Well, thank you.
Okay, thank you, Sandra. Anybody else? Okay, well, if any questions do pop into your head, you have that number, 1-800-243-4636. And you have a couple of options. You can either go right to Prescription Advantage and talk to them, or you could go to Shine and talk to them about Prescription Advantage as well. Either way.